community, and we are really fortunate that we're supported by the community, so we don't have to worry about, advertising and, like proprietariness. We just want to share with the community and get information out there. So in any way possible, that's really exciting for us. So thank you for that, Shaun.
You're welcome.
All right. Kasey, how is everything going in your office?
Great. I think you'll see me in there next week. Everything is just about done. They're just putting in the sink. I'll be moving like all of my things downstairs. It'll be nice to finally have a home. Just been all over the place. So that's really exciting. Also, some of my flu vaccine came in, so we're going to be hosting a flu clinic very soon. So things are moving along nicely. It's nice to think about something other than COVID for a little bit.
I know.
Having a nice new office and thinking about how we'll use that office to serve the community later on once COVID is out of our faces.
Yeah.
And it's nice to do other things. So it's good.
Have you counted the hand sanitizing stations in the building? Because I'm sure there's a lot.
There are. Yep, there's plenty of them. They're right at the entrances. So as soon as you come in, sanitize. And if you come in the back door, I'm right there. So it's like a police officer waiting for you to sanitize your hands.
Excellent. So actually, I'm interested in what you said about the flu vaccine. So I have a question. Does it matter when in the season you get the flu vaccine? Is earlier or better, or later better, or does it not matter?
Okay, so in New England, we have kind of a longer flu season because it kind of trickles into, March sometimes. So it's better to get it towards the end of September, beginning of October versus like running out to get one, today. It's better to have it a little bit closer to like the end of September or early October. Certainly, even if you got it done after that, it still offers benefits, but you just don't want to get it done too soon because you want that immunity to last a little bit into our longer flu season months.
Okay, thank you. That's really important. Okay, so Shaun, tell us everything that's new.
What do we have?
Just in general, everything.
The Triple E season is going really well. No, it's one of the things that we've been doing of late is housekeeping as we get ready to go into the fall and as the students and as the schools are preparing to reopen. So we've been addressing that. I've started following up on the travel order documentation just to verify that it's working, that people are complying, that we're addressing questions about testing and access to testing that might have come up. I've been asked or addressing, no, I can't turn off the automatic notification. If you got tested on day 3, you're going to get notifications until day 14. I have no control over that, and they will not turn that off. And then, one of the things that we've been studying the trends of, I think we're probably over 400 residents have traveled, or 400 people have traveled in and out of Hopkinton since the travel order was put in place. So again, that goes to the fact that our most recent cases have all come from travel. And I think the other thing of note that's come up is, we're starting to get what we're going to have two residents are returning from college that had either been exposed to COVID or had COVID. So this is something that we realize that we really need to start, preparing parents in Hopkinton for either their return if their school shuts down, how do they handle quarantine, and then how do they prepare for the holidays? Because as kids start returning or maybe the kids don't return for the holidays. So it's putting a plan in place for your children that might be returning from college, because if they're coming from a hot area, they're going to have to quarantine or get tested. And then you might want to maybe rethink the guest list to make sure that, you don't have any highly susceptible guests at the event, or to figure out how you can control it. So those are some of the issues that we've been kind of working on right now. And then just all of the communication that goes along with, the school reopening and town meeting. Those are going to be key things for us to focus on.
And now that you say that, Shaun, I was just mentioning to Jim earlier that I saw in a local publication, it's probably just because it got published so long ago, that they're still saying that September 21st is the town meeting. I believe that that's not true, but I wanted to make sure that I got it out on the air, that it really is the 12th.
It's the 12th.
And it'll be at 9:30 in the morning at the Hopkinton High School, where they'll have the tent up.
Right. We'll have several tents. There'll be a tent for the select board. There'll be the large tent for up to, I believe, 200 residents. There'll be a side tent that there'll be two other side tents, one for just if there are issues, or
Mike,
we'll call it the unknown tent. And then I believe there'll be a tent set up for non-resident employees, like myself. So, and then there'll be additional seating off to the side if that is needed.
And are they still anticipating around 200, 250 as a possible number of attendees?
The last count I had was about 150. But the key is that we've got the seating, we've got everything will be spaced 6 feet. People will be wearing masks. You'll sanitize your hands. As you enter into the corral to get up to get your voting card. So we've got a series of steps in place to protect both the volunteers that are working the event, the people that are participating in the event, and then the select board and employees that have to be present at the event. And it's why we're starting earlier. We want to make sure that we can get everything done as quickly as possible in an open environment that supports our efforts to reduce the risk of contracting the illness. Having an early start, if it were to go later, would provide us the opportunity to finish the event before dusk or nighttime. The area, for those that might be concerned with mosquito-borne illness, the area actually was just treated. So we made an effort to try to knock down the mosquito population that might exist in that area. And we're looking at, just all of the other things that we might want to control for. But, I'll be monitoring the mic and cleaning and sanitizing the mic between users. So we've, I feel that we've done everything that we need to do to get out.
Yeah, it certainly sounds like it. I was just wondering on a personal note, because HCAM will be filming this, putting it out live for the community. How much in advance will that tent be up? Will it be up the weekend before? Will it have to go up the day of? Will it interfere with school operation?
No, because that's why we moved it to the 12th, because it's before school.
Oh yeah, the 16th.
So it'll go up. I believe it's going up that Friday, because at the end of the day, we're trying to get in and out of there and support the school's reentry, or not interfere with the school's reentry. And heaven forbid something happens that weekend and we have to postpone it. It does give us a couple more weekends to be able to hold the event, because that was the other concern, is that I believe there's a requirement for us to get the town meeting completed before the end of September.
Yeah.
So given all of the different variables, having it on the 12th was the best thing that we thought that we should do.
Sure, and hopefully it won't go into the 13th the next day. I assume it'll be just as much trouble breaking everything down and getting it out of the way in time for schools to start on the 16th.
I mean, we've hired professional tent, like a professional vendor, and that's all they do, is they put up tents and take down tents. So they're telling us they should be able to get it out, I believe, in a day and a half.
That's good.
And then they'll patch the holes for so Tim doesn't have a damaged parking lot.
Yeah.
So
I'd like to circle back to something that you said. You talked about spraying for the mosquitoes, and earlier on today, you talked about how the Triple E season is going. So could you expound upon that? And when is the Triple E season, and when can we expect to be in the clear?
So Triple E, this is the earliest that the state has ever identified Triple E bearing mosquitoes. And what was really unusual this year was that I think the first mosquitoes were identified out in west central, almost western Mass. And then the second batch were identified where you expect to see them, out in that Carver, Middleborough, Plymouth area. But one thing that's worked in our favor is, for the majority of the Commonwealth, we've been in a significant drought, and the mosquitoes that bite both the infected birds and humans, they rely on cattails to I guess to survive.
Mm-hmm.
The eggs are laid around the cattails. They inject their snouts into the cattails and breathe through the cattail, and that's how they survive. It's this unique strategy that they've developed to protect them from pesticide applications and other issues. But absent the cattails, our population is down, I think it's 80% from what it was in 2018. So there's a whole, I go in on a weekly basis to review all of the trapping data, the testing data. I get updates from the state, from the Mosquito Control Board. And the only mosquito that's really doing well is this common mosquito. And the common mosquito can carry West Nile virus, but what the state's reporting is that the vector that brings it up into the Northeast, that vector hasn't really been present. And so there's something else that brought it up here this year, and that it's really been limited to that Brookline, say that arc from Medford down to, say, Newton, which is good news for us out here.
Did you say the mosquito population is down 80%?
Yeah. There's an amazing amount of data that is collected and presented. So what they do is they compare it to last year's data, and they carry it back a couple of years. So I can go in, on a week-by-week basis and look at all the counts, and then they report out, whether or not any of my the most commonly identified. So the pool, I think we have 13 locations in town that they sample from, and they sample for a whole variety of different mosquitoes with different types of traps. And and then they focus, and I have them focus on those mosquito areas or those trap areas where we have a history of either West Nile or Triple E being identified. And then we work to put together strategies. So like Aprilla Farms is a common area for West Nile virus. So, early in the spring, we started getting reports that helicopters were being spotted over those areas. And what they do is they deploy an organic bacteria that happens to feed on mosquito larvae. And so we had that area treated throughout the early spring to, with the goal of knocking down that population. It's the same, I think it's basically the same stuff you can buy, and if you have a rain barrel or whatever, or a koi pond, you can put that same stuff in. And then we just monitored our other testing locations for evidence of the mosquitoes that are most likely to transmit Triple E. That's what I do, like between 10 o'clock and 12 o'clock at night.
Wow. I think that's very dramatic. Wow.
And it's like, just like, we have a good system, and, in Massachusetts, we have a better than average system for handling COVID. So it's, when you have the systems in place, it as long as people are going in and checking their data, and they know who their mosquito control people are, they know who their COVID people are, it makes it a little more manageable. So,
wow. So does that impact? What else are we worried about? Any other things with insect infestations? It's just Triple E and.
I think that we should be worried about ticks.
Yes.
We have a really high rate of like Lyme disease and aspergillosis, babesiosis, and these are illnesses that really mimic the signs of COVID. I've talked to people that thought that for sure they had COVID, got tested, it was negative, and I said, you might want to get tested for these other things because the symptoms can mimic the same thing as COVID, like fatigue, fever, muscle aches, headaches, and a lot of people actually have it in Hopkinton. My poor dogs, both of them have it. One of them has aspergillosis right now, the other one has babesiosis. And 6 months ago, because they get tested every 6 months, they didn't have it. And we treat our lawn, they're on flea and tick medicine. It's just so common for this area. We at least see 1 to 7 a week for Lymes. And then a couple extra ones trickle in of other tick illnesses. I spoke to one of the cases last week. She was very sick. And one of the things she didn't know, which we have in town, is we have the ability to say if you get bit by a tick, you can send that tick off, and for $15, they can test that tick and see if it is carrying any of the diseases. So you can kind of have an idea on whether or not you need to go to your primary care and start some treatment. Because the sooner you can start treatment, like doxycycline or antimalarial drugs, whatever they're going to give you for whatever illness you may have, the better off you are. The sooner you can start those. So that's definitely something important for residents to know. It's a service that we have, and it's easy enough to do. Just save the tick in a little Ziploc bag, you send it off, and $15 later you can kind of have a little bit of peace of mind on whether or not you need to investigate this a little bit further.
Right. Could you please explain 1 to 7 cases a week, did you say?
Yeah, so we probably get between 1 and 7 cases a week of some tick-borne illness-related type of illness. And sometimes they can be Lyme's, which we don't have to follow up on. They are just for your notification that there's another case of Lyme's. And then there's other tick-borne illnesses like an aspergillosis or babesiosis. Then those ones we usually call, and we have to answer some case questions about. So we'll ask them about symptoms, if they were hospitalized, some other pretty simple questions.
And do we know how the tick population is doing this year?
it's been ebbing and flowing because ticks don't like dry, arid conditions, so they tend to stay hidden in the leaf litter where there's some moisture. Things I never thought I'd become a specialist in, tick-borne illness. So throughout most of the year, they've been laying low, but then after we have a heavy rain event, they're quote unquote hungry, and they're going out. And at this time of the year, it's the nymph ticks that are a sesame seed or the head of a fine ballpoint marker. And I say if you don't like wearing glasses, there's no way you can do a tick check for these because they are so small. I think we've demonstrated over the last couple of years with my interns projects that this is in fact the leading cause of illness in town. These nymph ticks are the source of that illness. And one of I guess my projects that I had intended to run this year was to demonstrate how easy it is to treat your footwear with permethrin, because if you treat your footwear, your like golf shoes or whatever, your gardening shoes with permethrin, if they get on your shoes, they're going to die on the shoe before they get up to your ankles. And yeah,
Okay.
that'll be.
I'm just gonna write the word permethrin down because that's it's really important to me.
Yeah. Would you spell that for me, Jim?
It's
I guess not.
Yeah.
No.
You do it phonetically,
Never
Bob.
mind.
But
Yeah.
Do it phonetically.
and then once like I have the signage, I have the trail booklets, I have the booklets, I have the signposts. We're in the process of painting the signposts. We have the tick awareness signs, and it's just I've got 7 of them. I think 7 of the signs painted. But once we get everything assembled, we have 25 signs that we're scheduled to put up, and we have approval to put up on the different trails in town, just reminding people to take precautions. Each one of these trail boxes will have tick identification cards on them, and they will have they will also refer residents to the UMass Tick Lab where they can send their labs or their ticks for testing. So,
Okay, I have a great vision. Hand sanitizer, permethrin, shoe sprayers. They could be a pair. Great. Kasey, can you talk about timing? For example, if I see a tick on me, before I freak out, is there a certain amount of time that it takes for me to have to worry? So like, do I have to check myself every 12 hours or how does that work?
I mean, Sean's going to answer this question because he knows like the exact hours and based on how much sunlight the tick got. I don't know if it was a Thursday, if you need to worry. Like, I don't know about that.
Okay. So roughly for most of the ticks, they need to be in you, like biting and lodged in you for at least 24 hours. So if you I like using myself, and against my wife's wishes, I use my kids all the time as examples. So one of my daughters got bitten. We pulled the tick out. There are ways for us to figure out how long it had been in there for about 18 hours. The tick had Lyme disease, but because it had only been in there 18 hours, all we did was elect to monitor her for illness, because the chance of her having, or the risk of the virus being transmitted before 18 hours was really low. And what we did, that was back probably 4 or 5 years ago. and then we just monitor her every 6 months for illness, and she was fine. Most people, and we've had actually a whole host of residents who have pulled ticks off of them, and they'd been in, say, from 10 to 20 hours, and everybody came out without illness. They really need to be in there for a fair amount of time. The problem with these nymphs is they're so small that you might actually just think it was maybe a small mosquito bite that you scratched and you got a little blemish on your leg. I know when I got bitten about I don't know, 7 years ago, and like I had no idea that I was bitten. One day I was wearing shorts, and my wife saw that I had a bullseye that went from my mid calf up, above my knee, and I'm certain it was a nymph that got me, but I happen to have, I got the tick vaccine, and they're still evaluating whether or not that's what helped me out.
A tick vaccine? I haven't heard of that. What's that?
Back in 1992.
Oh, that's why I don't know about it.
It was out there. It was out there for about a year and a half. Called it was Lymerex, and I went through the whole 3-shot protocol, and then it got pulled because it really got pulled because of political reasons, and the guy who developed it works at Tufts in Grafton, and they're looking at a couple new vaccines that are based off of the one I got, and but and again, like COVID, until there's the vaccine, the best things you can do is just protect yourself, treat your shoes, and do tick checks or tick showers after you're out in the woods, or and you can get your yard treated. You can treat your yard. I get bifenthrin, and I for I think $7 a bag, I throw it in my my spreader. I do the peripheral areas of my my yard, and knock on wood, I haven't had adult ticks, or I haven't swept my yard and found nymph ticks in 2 years.
Wow.
And Laura Davis would approve that methodology. It's a pretty low risk method of treating a yard for ticks while being safe for bees and other wanted insects.
Right. Okay.
Well, I can confirm that happened to me when I had a tick bite. I actually had the Lyme disease, but I know you mentioned the bullseye rash that you're supposed to look for. But when I got it on my arm, it was the size of a caraway seed that I thought it was just there. I brushed it away, and then I noticed a spreading rash. It started this little dot. A couple days later, it was the size of a quarter. Then it was up like 1.5 inches across. And when I went to the doctor, she just looked at, oh yeah, that's Lyme disease. I came to around 5 of these this week, and they gave me some, I think it was steroid treatment that I took to supposedly alleviate it. But fortunately for me, it never went any worse than that. I was surprised to hear Kasey say that some people suspect that they have COVID-19 because they have those symptoms, and it's also could be brought on by a tick bite or mosquito bite. And that was a surprise to me. So there's more than just looking at somebody that's wearing a face mask. You also have to check for bug bites, mosquito bites, tick bites. Oh boy, that's a lot.
But like one of the things that we're gonna, as COVID winds down a bit more, we've been approached to run like the Central Mass basically be like the Central Mass repository for tick information and best practices. The University of Massachusetts is supporting us. We have some legislative support, so it's we're trying to figure out how we would do it and who would put the website up, and then there are a couple grant opportunities that we have that have just been put on hold until COVID's over.
But what I'm hearing, Shaun, is it's not safe for me to go out and cut the grass. I just have to let it grow.
No, it's better for you to cut the grass.
That's the wrong answer.
Thank you. Thank you
And,
very much.
and they're less likely to be in the grass. It's that transition zone where it's the taller grass, the weeds, and you want to avoid leaves. You know what drives me nuts is now if I don't see you with a mask on, or if I see you raking in the leaves with shorts and
Well, you won't
I
see
wonder.
me raking in the leaves and shorts now.
Yeah.
Yeah.
The record we had this year was one of my kids went out for a walk and came back with 5 ticks on them. That was like, oh my gosh. But this guy likes to really go out into the woods and take pictures of birds. So he was in a high risk zone.
Yeah. So.
All right. Actually, so we have a few minutes now, and I'm hoping been trying to get to this. I'd like to get to this. So, Kasey, you are a nurse, right?
Yes.
So you work for the Board of Health Department. So I'm curious, if you could talk a little bit about what you do and why you joined a town Board of Health Department versus going into private practice and taking appointments.
Gift of God.
So I guess, before I was a public health nurse, I was a nurse in an acute care setting. So I did a couple different types of specialties. I was an oncology nurse for a little bit. I did cardiac, and I was in the ICU for the past 4 years before I became a public health nurse. I was looking for jobs in Hopkinton because it's where I live, and I thought, oh, how convenient would that be for me just to be able to go right to work where I live, and stumbled upon the public health nurse job. And I was talking to my husband about it, and I was like, it says no holidays, no weekends. And he was like, oh, do it. So, so I applied, and, as I kind of read a little bit more about it, I was like, this sounds like something I could do. Like, I really do enjoy educating people. And I was, wanting to do something that felt like it was worth my time. Not that being a nurse in a hospital isn't worth your time. It absolutely is. But I wanted to find something that I felt it was worth the time I was taking away from my kids. So this kind of fulfilled that for me. And when I started in November, not being in public health at all and just being in an ICU setting, I really had no understanding of what this would entail. I remember twiddling my thumbs for 2 months, wondering what did I just do? This is just so different, and it was so unstructured, and it just kind of was what do you want to make of it, instead of this is what you're doing and you do this every 10 minutes, and it was very different from where I came from. But I am enjoying it. I do really like the connection that I feel with people in town. I do feel like it was a much needed role even outside of COVID. Thank God that we have a public health nurse in town,
Right.
but it's a role that was needed anyway. There needs to be more advertising and just awareness of the type of things that we are doing in the health department. I think most people think it's just wells and kind of you just go there to get your building permit. But, when you hear Shaun start to talk about all the programs and initiatives that he's been a part of and have helped to create, it's I live in this town. How did I not know about that? So, I really think that this position was important for COVID, but like going into the future will be so important to making sure that people feel connected and are aware of the services that are pre-existing in town. Like all these things are already here. We just need to make sure that people know that they're here. You know, so and just working with the different groups in town to make sure that we are connecting those goals, you know. So when we do the flu clinic for the seniors, the fire department is going to be working with me, and they actually do like a silver shoe program and like a preparedness program, which will be great for September, because September is EP is essential month, because emergency preparedness is essential. And just showing like that teamwork, and then serving two purposes in one drive-through, I think will be great. It shows the teamwork, and will reconnect the town.
That does sound great. Now, are you keeping up? I know it's only been since, I think you said November, with certifications and licensure, and is that aspect required for the job that you do?
Yeah. So some of the things, like in a typical acute care setting, like the only things that you would do is like go to staffing and services. So like I would do my ACLS, BLS classes, and then do like the ICU review every year. So you review like those skills. Public health is a little bit different in that like I'm not operating that same type of machinery and stuff, but like I will keep my ACLS and BLS courses up to date. Some of the things that are different in public health that I had to learn about, it was establishing the vaccine program for the town of Hopkinton so that we could get free vaccines for all adults that are uninsured and all children under 18. So those vaccines come right for the state, and those are free because I completed that application. And then also I went through like doing our enrollment for Medicare, and I'm working with the other public health nurses to make sure that we have the same and more programs to support our community.
Great. Shaun, how long have you been the Board of Health Director?
3 years.
3 years? What's your background?
I was an environmental consultant for 15 years. I used to consult for the Egan's. I worked for the Fortune 50. I traveled 200 days a year, and then when my mom got ill, my dad needed help with her, so I left a well-paying consulting job and took a job with the city of Boston as a sanitarian and as a food inspector, and then I had always kept I'm a registered sanitarian, and I became a sanitarian back when I was in grad school, and I kept that license, so that just transferred right into the work I did in Boston. And then because of with my master's background and everything, the Boston Public Health Commission brought me under to work for the Department of Public Health and the CDC. So I did a lot of their field work and field investigations, which then that's how I know all the regulatory people, because of those experiences. And then Boston has residency, and it was expensive to try to raise a family in Boston. So I took a job as the food safety specialist for Shaw's in Star Market. And but I never got to see my kids or my wife. That's actually why my bullseye went so long, because kids and my wife never saw me when there was light out. And then I was looking to get out, just so I kind of like Kasey's, just so I could see my kids and be with my wife. And I knew Hopkinton from the work I did for the Egan's, and some of the work I did for PerkinElmer. And yeah, I did a lot of work on South Street. So it was a good opportunity. And and I jumped at it when I saw it. So.
Are there any special certifications or licenses for that position?
Yeah, I mean, the sanitarian is the biggest one because it's like being a professional engineer. Most people that take the sanitarian exam fail it the first 6 times because you need to know everything from food to hazardous waste to swimming pools, how to install a well, housing code, pandemics. It's the book, the textbook is,
Right.
but so you once you get it, you hold on to that, and but the examination process, really prepares you for what this job, and then like Kasey said, there are annual training requirements that I got to complete. There's a certain amount of hours and CEUs I have to obtain each year to maintain my sanitarian license. And then there are classes constantly on well installations, septics, on,
Pandemics.
for food practice, like that. But,
so before Kasey, was it just you?
yeah, I had a public health nurse, like a contract nurse. All she did was assist me. She assisted with the tougher cases where I actually needed nursing, but we weren't doing anything. Like, I'd go into Maven, I'd see we had a case. I might do some of the tick-borne stuff, but I'm not a nurse. I couldn't do much beyond that. And then then you're looking at all this stuff that could be done, and all of this like professional experience that could be brought to bear to assist the residents in town. And we can prevent, there's fall care we can be doing. There are people that go to the emergency room for stuff that we could easily address on the local level. And these are the things that if we're doing this work, we're improving the overall health of the community, and then saving the residents.
And what I love about Kasey, you're full time, right?
Yeah.
Talk about timely, huh? Talk about that. Just a couple minutes, crazy. And what I love about this town is that it's getting some really quality departments in. Your department and the Youth and Family Services, those are departments that are about caring for the community. So I love that. But Bob's tweaking me. He's got a question he wants to get in.
Yeah, this is my question, and I wanted to point out that actually I've been doing government meetings for a while, and I remember when the Board of Selectmen brought Shaun in and accepted him and hired him and brought him in. And I remember the meeting, and I was thinking to myself, what do we need a Board of Health Director for? There's nothing going on here. And then later on, a couple months later, maybe, I don't know how long it was, Shaun came before the board and said, we need to hire a nurse. We need to have a nurse with the Board of Health. And then I really thought, what do we need a nurse for? And I have to admit, now I know what we needed a nurse for. And it was very intelligent of everybody to hire Shaun and Kasey to bring them in, because it was necessary. We'd really be in trouble if we hadn't had them to take over this whole operation. I can't imagine what would happen if we were just letting police, fire, or someone that didn't have the expertise that they do, trying to follow up with the state and coordinate. This has really been a good find for the town. And I personally want to thank Shaun and Kasey for coming on board and doing the job that they're doing.
Thanks.
Yeah,
I agree, because this throughout this whole pandemic, the information has just been changing, ever changing. Just all the numbers and different information come out. To be able to hear from the two of you, whose job it is, you're paying attention to this stuff and are able to bring it, not in larger scale terms, but into what's happening in Hopkinton, not only has been very informative, but also very reassuring as well. Because you're able to talk about like plans and systems in place for the businesses in our community, for the recreational spaces, for the schools that are coming out. It's really great. It's really great information.
Yeah, I mean, I think like, you know, um, I'm not happy that COVID happened, but like to some extent I am happy that people acknowledge that there is a health department in town, and and like just realizing like all the stuff that we are capable of doing. And I'd like to think that we do our job really well because we truly both really care about the outcome. And I think that we have done a really good job, but also the residents have been super helpful because they actually listen and digest the information and then do what they're told. But I think I'm proud of all the things that we've accomplished. Just today, I was looking at the website that I created, which has a lot of like the infographics and stuff that we have created for COVID and other reasons. And you can see a map of who's accessing the information. And it was pretty cool to see that because it's all over the map. There was like 5 people in California that were looking at it. There's people in Florida that were looking at it, Vermont, Maine, and you like zoom in on the map and there was, I don't know, maybe 20 people like in Boston that had just clicked on one of my blogs. So it's nice to see that people are looking for the information, and it's not just important for us, but it's good information that everyone's trying to access.
Now, Kasey, there are people out there right now who are saying, oh, what website is she talking about? How can they find it?
So we do have like the town website, but then one of the first things that I created when I first started was healthyhopkinton.com. And that has all of like the public health nursing stuff that I do. It includes my blog, which is under RN in Hopkinton. On there, you can book appointments on there. So once I open up the flu clinics, you'll be able to book your flu appointment there. It also has direct links to like the CDC and information about COVID, some news links, and then also has like the information on the MRC and like the steps on how you would join that. I haven't updated much of the website. I do the blogs. I try to do them every couple of weeks just to touch in on what's changed and where like the direction we're trying to move. But
that is great. Healthyhopkinton.com. Great address.
Yeah, it was available. So,
but like at the end of the day, like I share, Kasey's Healthy Hopkinton with like my Facebook group, and what we're finding is that there are communities, both big and small, that are using what we've done here to bring programming into their own communities. So we've had there were 3 cities that were following what we were doing when we started our COVID work, and it's there are news media outlets that are sharing, like they're coming to us because of, as I said, they've seen reports, they've been to Kasey's website, they then started following us here, and they're trying to replicate what we've done, around the local area, Massachusetts. And I know there are a couple, I think I think LA, one of my old bosses is out in LA, and she likes checking in to just see how we're doing out here. So, but that's, this is part of this process, is that, we figure out different ways to do things. We, initially we were looking at what Florida was doing. Florida's really good at messaging. So we got some good ideas about how to do what we were doing up here.
Really? Florida is a good example?
Of messaging.
Florida was
Matt's good,
good
Jim.
in March. Like their documents were really good. They are much more clear cut. The stuff that was coming out from the state was like literally like a map that like if you got COVID on a Tuesday, do this, like, and then like it was all over the place. It was crazy. Where like Florida was like, if you're sick, stay home, don't leave for 14 days. Like, you know,
Right.
somehow that message became unclear, and that's why they're in the position where they're in, I guess. But at the beginning, they had really good documentation, and I don't know if it was because of their population. Obviously they have a lot of older people, so they had gotten a lot of good resources out in the beginning. You know, now I'm confident in what we're producing as a state, but in the beginning we're just scrambling trying to find best practice.
And
Yes.
that's one of the things that we do, you know, in all of our free time is we sit down and, you know, Kasey's reading through things at night, I'm reading through things at night. We come across something, you know, when we're out traveling or talking to people, and we try to bring all of this experience in and figure out how we can build, you know, just a better system to better serve the residents in Hopkinton.
Yeah. Is there anything new out there? I know masks. I know 6 feet. I know outdoors if you can. And I know limited, oh, sorry. Yes, Bob. Hand washing, sanitizing, and limiting the amount of time. Other than those 5 things, is there anything else that's new based on the experience?
So there's a couple of states added to like the safe state list. Colorado, I believe, Delaware, a couple states were added. So it's not just concentrated in that New England area anymore. There's a couple other places that are now.
West Virginia, maybe.
But that's about it for new things.
Now, do you two use face shields or do you go with face masks?
Face mask.
Yeah, we wear face masks. So like when would a face shield be appropriate if you were caring for a patient that had suspected COVID, or B, like there was community spread. So like when we talked about before, like contact tracing becomes ineffective at a certain point. So, and that's when there's community spread. That means there's somebody in the community that has COVID and we have no idea where it came from. So it's just potentially spreading from one person to the next. And then it would be appropriate to possibly wear that face shield, but then also we'll be in a very different place. We'll be back to like where we were in March if we go there.
Mm-hmm.
I'm
And
hopeful. Oh, sorry,
Go
Jim.
ahead, Bob. Go ahead.
I'm hopeful that, and I'm assuming that all the things that you're doing right now, I know it started from ground zero and now you're putting it all together. Hopefully in 2 years from now, this will become a lesson for others down the road, and the history can be used to improve things happening further on down the road. Is that something you're developing that you can work from?
Yeah, we're working with the deputy chief and his fire prevention officer Poirier on putting together an after action report. So that'll be a fairly lengthy report, just documenting everything that we had done, so we can learn from that, because again, that's how we help develop systems and protocols, and because neither of us had ever done anything like this. I've got a good hazardous waste background and a really good food background, but this was just, but it's what you did at a hazardous waste site. You got to control your environment, you got to limit your exposures, limit your time, and Kasey was able to draw from all of her experience, and it was just, it was that perfect meeting of two skill sets and just timing. And then I'm old, I'm terrible at web-based stuff. Kasey's a wizard at stuff. So
The one thing that we had that allows for us to do so well in a pandemic is that we have the right staff in the right places. So like when I and Shaun told like in an emergency management meeting, told everybody, like, this is what we're doing. It was like this. Everyone did it. Nobody said, why are we doing that? I don't want to do it that way. That's not how we do it. Everybody was willing to listen and just did it. And that's why we did so well.
Yeah.
But if we had people that were pushing back on these ideas because it wasn't said yet, like it was like there wasn't really like a map on how you should do it, like, so we had that pushback, we wouldn't be in the big place that we're in now. But we didn't have that. We had the right people that all agreed that health is not their thing, and they're just waiting to hear what we're supposed to do. And they listened, and they did a great job. So that's why we are where we are.
Yeah. Have you, I assume you've heard about some test that's being developed that's supposed to be, I don't know, 15 minutes, and it's really easy. Is there an expectation that will have any impact in our community?
Access to testing is absolutely important, right? So once we start to kind of suspect that like maybe there's transmission, access to testing is super important, so we can kind of see exactly how far it's gotten. If there's a test that is FDA approved and it's a PCR test and it's able to provide those results in such a quick amount of time in a simpler way than in a simpler but same as effective way as an NP swab, like by all means bring it in. But like if those standards can't be met, like it doesn't help that it's 15 minutes, if it's the wrong answer.
Right. True.
And then we need to be able to share that data. That's one of the issues is, they talk about the software that Google and some others have produced that can help with the contact tracing. But if that data is not getting to the public health departments and the state health departments, then it's great that you've been identified as a contact, but
yeah,
we need to then be able to work with that. And so there's talk about some of this new technology that they're getting ready to bring to market, but then it's making sure that we've got a plan in place to,
okay,
I can spit on a credit card, but what am I gonna do with that data after that?
All right. Hey, we got to leave it there. Thank you so much. Have a great day. And I wish we had more time, but we'll look forward to seeing you back next week where we continue the conversation.